What do you say when a patient tells you they're hearing voices? Do you challenge it or do you treat it? What you're about to see is a real clinical approach to one of the most challenging symptoms in psychiatry. Let's talk about what's been happening.
The voices are back. I'm scared.
That's understandable. Let's test that thought. Okay?
Good.
We'll practice this. Hi, it's good to see you today. How have things been since our last visit? They're still there. The voices, they keep telling me I'm not good enough. I hear how difficult that is for you. You're not alone in this. That sounds really distressing. I'm glad you told me. You're not alone in this, and we can work through it together. Can I ask a few questions about the voices? When do you hear them most? What do they usually say? Do they ever tell you to do anything? When do you hear them most? Can I ask a few questions about the voices? When do you hear them most? When I am alone, they are loud. What do they usually say? The voices don't tell me to hurt myself. They just insult me. They don't tell me to hurt myself. I see. Thank you for sharing that. When the voices say you're not good enough, how true does that feel to you? It feels very real. Let's pause and examine that together. What evidence do you have that you are not good enough? So you're saying these voices are always right? I don't know. I guess I've done some good things too. Exactly. So maybe the voices are not always accurate. Do others hear the voices when you hear them? No. So this might be something your brain is producing even though it feels external. When the voices get loud, what have you tried so far? Nothing really. Let's try a few strategies: listening to music, talking to someone, focusing on a task. The goal is not to fight the voices, but to reduce how much control they have over you. You are still in control. Your medication also helps reduce the intensity of the voices by balancing brain chemicals. Therapy and medication work best together. That makes sense. Exactly. We'll monitor this together. Today we worked on understanding the voices, questioning them, and using coping strategies. For next time, try using music or distraction when the voices start. You're making progress. Thank you. I feel a little better. In this session, we focused on helping a patient manage auditory hallucinations using psychotherapy. We began with validation to reduce the nature of the voices, ensuring there were no command features. In cognitive behavioral therapy, we helped the patient challenge the authority of the voices and develop control. Finally, we taught coping strategies to help the patient reduce the intensity of hallucinations in real time. This is a simulated clinical scenario created for educational purposes. It is not a real patient encounter and should not replace professional medical advice or treatment. Can therapy alone help? Yes, in some cases. Therapy may be effective when symptoms are mild to moderate, and when the patient has good insight, like knowing voices aren't real. Therapy alone can also be used when the voices are not commanding and not dangerous. Also, when hallucinations are linked to stress, trauma, or anxiety. When therapy alone is not enough. Therapy is insufficient when symptoms are severe or voices are commanding. In these cases, antipsychotic medication is the first-line treatment.
Why are you talking to me? No, I won't do that. Stop talking to me. Stop talking to me.
No, I won't do it.
Leave me alone! Get out of my head! Stop it! Stop talking to me anymore! Just shut up!
Do you hear voices when no one is around?
Yes, I hear them all the time.
What do the voices say?
They tell me I'm worthless.
Do they tell you to harm yourself?
Yes, alone!
It's okay, we're here to help. Let's move away from the wall now.
I don't want to go!
You're safe, just come with us. What you just saw is a common presentation of auditory hallucinations. Auditory hallucinations are one of the most psychotic disorders, such as schizophrenia. When a patient reports voices telling them to harm themselves, this is a psychiatric emergency. The clinician must immediately assess risk, ensure safety, and provide support. Patients should be encouraged not to act on the voices, to stay around others, and to seek immediate help by calling 988 or going to the ER. Treatment involves antipsychotic medication, psychotherapy, and close monitoring. The goal is to reduce risk, stabilize the patient, and restore safety. This video is for educational purposes only and is designed to support learning for nursing students and mental health professionals. It does not replace clinical judgment, professional training, or individualized patient care. If you or someone you know is experiencing mental health symptoms or a crisis, please seek help from a licensed healthcare professional. In the United States, you can call or text 988 for immediate support or go to the nearest emergency room. If you found this video helpful, make sure to like, subscribe, and share with other students and clinicians. now and turn on notifications so you don't miss the next lesson. Thank you.